If you take your metformin with your morning glass of orange juice or a piece of toast out of pure habit, you need to stop what you are doing and watch this. If you take your insulin dose right before you head out the door for a brisk walk, a round of golf, or a session in the gym, the same thing applies. And if you have ever skipped a dose of your blood sugar medication because you forgot, and then tried to catch up by taking it right before a heavy dinner, we need to talk immediately. What I am about to cover is the exact clinical reality that your pharmacist rarely has time to explain at the drop-off counter. It is the anatomy of a hidden crisis, the most dangerous time to take your diabetes or insulin medication. Every single week in clinics worldwide, thousands of patients managing type 2 diabetes or insulin resistance make a simple timing or dietary mistake. It is a mistake that most doctors completely overlook in a standard, rushed 15-minute appointment. If you are taking your glucose-lowering medication on a fixed schedule without aligning it perfectly to your body's metabolic clock, you aren't just cutting its effectiveness in half. In the worst-case scenarios, you are actively creating a critical, hidden window where your blood sugar can plummet into a dangerous emergency zone, or skyrocket so high it causes quiet, long-term damage to your microvascular system, your eyes, your kidneys, and the delicate nerves in your feet. What I am revealing today is the exact guidance given to patients behind closed doors after the prescription pad is already put away. This is the critical conversation that simply isn't happening in the exam room. Stay with me, because timing mistake number 3 involves a specific breakfast routine that surprises almost everyone, and it is actively neutralizing the primary drug prescribed to over 150 million people worldwide. If this kind of raw, honest clinical insight is what you want to protect your health, take 1 second to hit subscribe. I break down complex medical realities into actionable survival tools every single week, and you cannot afford to miss what's coming next. Mistake number 1, the pre-workout dosing trap. Let's start with a medication class that millions depend on. Secretagogues like glipizide, glimepiride, or direct fast-acting insulin injections. These medications are fundamentally designed to do one job: force your pancreas to pump out more insulin, or directly add insulin to your bloodstream to clear glucose out of your blood. For decades, the standard advice has been, stay active, exercise lowers your blood sugar. And that advice is entirely true, but here is the massive gap in that instruction. Physical exercise turns your skeletal muscles into absolute sponges for glucose. When your muscles contract during a brisk walk, a bike ride, or heavy yard work, they open up specialized gates called GLUT4 transporters. These gates pull sugar out of your blood without even needing insulin. Now, imagine what happens inside your body when you take a medication that forces insulin levels sky high, and at the exact same moment, you start a high-intensity workout. You are simultaneously pressing 2 massive accelerator pedals to drain sugar from your blood. This isn't a minor calculation error. It creates a sudden, catastrophic drop in blood glucose known as severe hypoglycemia. Within minutes, your brain is starved of its primary fuel. You feel the sudden onset of cold sweats, internal shaking, a racing heart, and intense confusion. In severe cases, patients faint while walking or driving, leading to emergency hospitalizations. I want to be completely candid with the science here. Exercise is medicine, but it must be timed. If you are taking fast-acting insulin or sulfonylureas, taking your dose right before unexpected, strenuous physical activity is a direct recipe for a medical emergency. What should you do instead? You must consult your care team about adjusting your dosage downward or consuming a controlled, complex carbohydrate snack if a workout is planned within 2 hours of your dosing window. Never let your medication and your muscles compete for the same pool of blood sugar at the exact same intensity. Mistake number 2. The healthy breakfast conflict. This brings us directly to the second timing disaster, and it involves the single most prescribed diabetes drug on earth, metformin. Metformin is an exceptional medication. It works primarily by traveling to your liver and shutting down its ability to produce excess glucose overnight, while simultaneously making your cells more sensitive to the insulin you already have. Because it can cause mild gastrointestinal distress, the standard prescription bottle reads, "Take once daily with breakfast." So, millions of well-meaning people wake up at 7 a.m., sit down, and take their metformin alongside a bowl of oatmeal, a piece of whole wheat toast, or a glass of fruit juice. Here is why this timing creates a profound metabolic conflict. When you first wake up, your body experiences what clinical medicine calls the dawn phenomenon. Your adrenal glands release a natural surge of cortisol, growth hormone, and glucagon. This surge is designed to wake you up and trigger your liver to dump sugar into your blood to give you morning energy. Because of this, your insulin resistance is naturally at its absolute highest point of the entire day the moment you step out of bed. When you introduce a heavy load of simple or even complex carbohydrates, like that toast or juice, into your system during this natural morning surge, you create a massive, immediate glucose spike. Metformin is not a fast-acting sledgehammer. It is a slow, steady regulator that takes days and weeks to build up stable levels in your tissues. It does not have the acute power to instantly flatten a heavy morning carbohydrate spike. By taking your medication alongside a high-carb breakfast during your peak daily window of insulin resistance, you completely overwhelm the drug's absorption and regulatory window. Your blood sugar shoots into the 180 or 200 milligrams per deciliter range, where it sits for hours, causing low-grade inflammatory damage to your blood vessels before finally settling down. If you are prescribed metformin, you must understand that its job is to manage baseline stability, not to erase a high-carb morning meal. If your morning numbers are consistently high, despite taking your medication religiously every breakfast, the timing of your carbohydrates, not the drug itself, is likely the root failure. Mistake number 3, the fiber and binder blocking effect. Now let's look at timing mistake number 3, and this is the one that catches almost everyone completely off guard, because it involves choices that seem entirely healthy. Many people managing diabetes also take fiber supplements, like psyllium husk, or eat high-fiber seed blends first thing in the morning to help manage their cholesterol and digestion. Alternatively, they might take their diabetes pills at the exact same time as their morning coffee or calcium supplements. Inside your digestive tract, medications like metformin require very specific transporter proteins in your small intestine to be absorbed into your bloodstream. When you coat your stomach and intestines with a thick, viscous gel from a soluble fiber supplement, or when you introduce high doses of calcium or the binding tannins found in heavy morning coffee at the exact same moment as your medication, you create a physical and chemical barrier. The fiber traps the medication molecules inside its gel matrix, significantly delaying how fast the drug can enter your system. Instead of being cleanly absorbed in the upper intestine, the medication gets pushed further down into the colon. The result is twofold and deeply frustrating. First, the actual amount of the drug reaching your bloodstream drops significantly, leaving your blood sugar completely unmanaged. Second, the unabsorbed metformin sitting in your lower intestine ferments, triggering severe bloating, sharp abdominal cramps, and explosive diarrhea. Thousands of patients stop taking their life-saving medications simply because they assume they cannot tolerate the side effects, completely unaware that those side effects were entirely caused by taking their pill at the exact same time as their morning fiber or coffee routine. The absolute clinical rule is simple. Create a strict separation zone. Keep a minimum of 2 hours of clearance between your diabetes medications and any fiber supplements, binders, or heavy caffeine intake. Give your intestines the clear, unhindered window they need to absorb the medication properly. Mistake number 4. Doubling up after a skipped dose. This leads us to the timing mistake I observe most frequently in clinical history, and it carries the highest level of immediate cardiovascular and neurological danger: the catch-up disaster. Life gets busy. You forget your morning dose of Metformin, or you miss your midday injection. You realize your mistake at 6 p.m. right as you are sitting down to a large dinner. The natural human instinct is to think, I missed my morning dose, so I'll just take a double dose right now to cover this big meal and get back on track. If you are taking certain classes of diabetes medications, specifically sulfonylureas or insulin, doubling a dose to compensate for lost time is an incredibly dangerous gamble. Your metabolism does not work on a simple 24-hour mathematical ledger where addition and subtraction can happen at any hour. When you double up, you force blood levels of the medication to peak far beyond safe thresholds. Instead of smoothly managing your dinner, the drug causes an aggressive, uncoordinated crash in your systemic glucose levels later that night while you are fast asleep. This leads to severe nocturnal hypoglycemia. Because you are asleep, you cannot feel the warning signs of a crash. Your heart rate spikes, you experience intense night sweats, vivid nightmares, and you can wake up with a severe, disorienting neurological hangover, or worse, lose consciousness entirely in your bed. Even with a highly forgiving medication like Metformin, doubling up does not provide extra protection. It simply oversaturates your intestinal receptors, leading to severe gastrointestinal distress and cramping without offering a single milligram of extra blood sugar control. The universal medical guidance is clear. If you miss a dose of your diabetes medication, take it the moment you remember, only if it is within a few hours of the original time. If you are closer to your next scheduled dose, skip the missed dose entirely. Resume your normal schedule at the next interval. Never, under any circumstances, double your dose to make up for an error without explicit, personalized verification from your physician or pharmacist. The safe off-ramp and reassurance. I want to emphasize something of vital importance before we finish. Diabetes medications, when used correctly, are absolute lifesavers. They protect your eyesight, shield your kidneys from failure, and drastically reduce your long-term risk of stroke and heart failure. I am not telling you to alter your routine today without consulting your doctor, nor am I suggesting your current prescription is incorrect. What I am telling you is that the critical conversation regarding precise daily timing, dietary interactions, and lifestyle alignment is a conversation that our current medical system frequently fails to facilitate in a standard, brief consultation. That gap in communication leaves well-meaning patients unprotected. If you or someone you deeply care about is managing diabetes or insulin resistance, I want you to take absolute control of your next clinical appointment. Do not be passive. Bring these 5 specific, sharp questions directly to your primary care provider. Based on my specific daily routine, what is the optimal hour for me to take my medication to map against my highest blood sugar spikes? If I plan to do moderate or intense exercise, how many hours should I separate my workout from my last medication dose? Are there specific morning foods, fiber supplements, or drinks like coffee that will alter how this medication is absorbed? What are the exact step-by-step instructions for my specific prescription if I accidentally miss a dose? Should we utilize a continuous glucose monitor for just 2 weeks to map out exactly when my blood sugar surges occur naturally? Asking those 5 targeted questions clearly will do more to secure your long-term cardiovascular and metabolic health than any generic medical advice you can find on the internet. Your personal physician possesses your complete medical history. I do not. But I can give you the exact vocabulary to demand the care you deserve. If this video brought you real value, if it uncovered something you didn't hear in your last medical appointment, please share it immediately with a family member, a loved one, or a friend who is working hard to manage their blood sugar. Hit that subscribe button right now because I will continue to deliver the raw, transparent clinical insights that every single patient deserves to hear. Thank you for watching, take care of your health, and I will see you in the next video.